Welcome back to the show. Halloween, of course, tomorrow, but we're looking ahead. There's plenty more holidays. We can say it's officially the holiday season, right? Well, a lot of times the holiday season means you're spending more time with loved ones. And for some couples, that may cause some problems and some issues that you want to fix before the holidays roll around. Well, we've got just the guy who can help with South Bay Medical. Let's go ahead and welcome in Andrew Reinhardt one more time. Andrew, how are you today?
I'm doing well. How are you?
I am well. I love the fact that I'm able to say holidays really are around the corner. This is like the fast time of year, in my opinion. And you spend more time with loved ones, but sometimes there might be some issues that loved ones kind of want to work on. Right, Andrew?
Yes, absolutely. Erectile dysfunction, although I know it's kind of a sensitive subject. Some people hear that and they go, whoa, erectile dysfunction. But this is a significant problem. And as the holidays are approaching, certainly we will be spending more time with our significant other. And if you have erectile dysfunction, well, that closeness maybe isn't all that great. There is good news, however. South Bay Medical Clinic uses the most advanced form of something called acoustic wave therapy. This is a medical breakthrough for those struggling with ED. It opens up and regrows blood vessels, so men no longer have to take the pill. When we get the blood flowing properly in this part of the body, we get the normal function back. We get spontaneity back. With just a few short treatments, we can achieve this. So it really has been a breath of fresh air for thousands of couples all over the country.
Now, you say a few treatments. I know just kind of getting people to come to the office, some people may be a little hesitant about it. It's like you said, not a problem that people want to talk about. So with that hesitation, how many treatments are people looking at? What can they expect when they walk in? Because, of course, they want to know the results are there, but also what the process is going to look like as well.
Yes, so these treatments are very easy. It kind of looks like an ultrasound machine. You come into the clinic, it's placed on the skin for about 10 minutes. That's a treatment. You might do a few of those over maybe a 2 to 3 week period. So think about that. 2 to 3 weeks from now, you could eliminate the erectile dysfunction. You could eliminate the need for a pill. And by the way, those treatments, they don't hurt. They don't break the skin. They gently deliver pressure waves into those blood vessels. And you will start to see the results, typically starting on the first treatment. It progressively gets better until you get to the point where you don't have to take the pill and you get the function back like it was in your younger years, when things just worked like they should.
Now let's talk about the results, because of course that's what I'm sure is going to be the exclamation point for many. What are the results out there, and where can people go to learn more, say, about the studies that have been done on the results?
Well, this technology has been studied extensively. The science page at southbaymedicalclinic.com has, I think, 40 of those studies, and there are dozens more from places like Cambridge. Now, Cambridge tested the technology, and at the end of it, they said all men, this is really cool, all men improved their blood flow. Erectile dysfunction is a blood flow problem after all. It's blood vessels that have shriveled up, died, or are even blocked. So that is what we're treating. And this is on top of, we've treated thousands of guys. We've seen excellent results. The men are very happy, and also their significant others are very happy.
I'm curious, Andrew, and to kind of come full circle, since we were talking about the holidays when we kicked off this segment, this is a time to be joyous. Share with us, if you will, some of those patient reactions, because I'm assuming you have to hear those success stories quite often.
We do. Rich, one of our patients, he gave me permission to use his name, 77 years old. He was not just taking pills for erectile dysfunction. He was also taking injections. Nobody likes to do that. And I think he was struggling with ED for about 10 years. He was maybe a week and a half into our treatments, was able to eliminate the pill and the injections completely. His regret was maybe not starting sooner. We also heard from Rich's wife, who was very pleased. This kind of thing happens every day. It doesn't matter how young or old you are, what kind of health conditions you have. This technology can reverse erectile dysfunction.
You remember those commercials that were like, "Be like Mike" back in the 80s? I feel like we should say, "Be like Rich." Go ahead, give South Bay Medical a call today or visit the website. We've shared both on your screen. There it is again, one more time. Andrew, we appreciate you joining us today.
Thanks for having me.